Hello, it's Dr. Rhonda Johnson. Today is Saturday, April 24th, 2021. And today I'm going to be providing an update on the Johnson & Johnson vaccine. Well, you may have heard, folks, the CDC and the FDA on Friday, April 23rd, which was yesterday, their panel of advisors voted to recommend lifting the pause on the Johnson & Johnson COVID vaccine. They recommended adding a label about the exceedingly rare but potentially dangerous blood clotting disorder called TTS. It now has a name, folks. TTS, Thrombocytopenia Syndrome. Now, you may recall that more than 8 million doses of the Johnson & Johnson vaccine have been given here in the United States, and there were a total of 15 people who developed these life-threatening blood clots. All 15 were women, and 12 of the 15 women in the confirmed cases developed blood clots in their brain. Now, they took a look at the data, and they discovered that although this is rare, that women in the age group between 30 to 39 appear to be at greatest risk. Now, they're reviewing additional cases of this clotting disorder, and some cases may involve men. So we have to stay tuned to the additional reports which will be forthcoming. Now, based upon the number of doses that have been given and the number of cases of this rare blood clotting disorder called TTS, Thrombocytopenia Syndrome, it appears that the overall rate of blood clots was 1.9 cases per million people. And again, in women ages 18 to 49, there were overall 7 cases per million doses. So again, the bottom line, folks, is the overall risk of developing this blood clotting disorder is extremely low. Now, here's the challenge, here's the dilemma, that COVID itself is a virus which has caused blood clotting. 10% of the people who have COVID develop blood clots, and the risk of blood clots is even higher for people who have been in the hospital. So you have a vaccine against COVID, the Johnson & Johnson, which is causing blood clots, an extreme rare form of blood clots associated with low platelets and reduced clotting ability of the platelets. And then you have COVID infection, which has a much higher risk of giving you blood clots. That's a lot for the average person to understand, and I know that it creates a lot of confusion. And I know that people want to know, what would I do? Would I get the Johnson & Johnson vaccine? Well, first I want to say I've had both doses of the Moderna vaccine in February and March. So the answer to the question is hypothetical. Would I get the vaccine, the Johnson & Johnson vaccine? Yes, with a caution. Would I recommend it? Yes, with a caution. So women who are between the ages of 18 and 49, consult your doctor first, especially if you have any type of medical condition that might predispose you to blood clotting, or if you're on any medications that will predispose you to blood clotting, or if you have a lifestyle that involves sitting a lot or traveling for long periods on an airplane, I would definitely recommend that you talk to your doctor if you're between the ages of 18 and 49 prior to getting the Johnson & Johnson vaccine. Now, there are two other COVID vaccines you can get here in the United States that haven't been associated with this rare clotting disorder. Both the Moderna and the the Moderna and the Pfizer vaccine. The risk of blood clots is rare. So my bottom line is I advise getting a COVID vaccine over COVID. COVID, the infection, can cause blood clots, death, long COVID syndrome, brain impairment, heart impairment, lung impairment, hair loss, erectile dysfunction, loss of limbs, and kidney failure. The vaccine, which is easy to get access to now, they're having to close vaccine clinics because people aren't showing up, is not associated with these side effects. Just minor inconveniences of pain on the site, headache, fever, tiredness, fatigue that lasts 1 or 2 days and is relieved with Tylenol or ibuprofen. And the reality is we've got 8 billion people in this world who haven't been vaccinated. And the Johnson & Johnson vaccine is protective against the South African variant, the Brazil variant, the UK variant, and most of the world is in desperate need of COVID vaccines. The Johnson & Johnson vaccine is easy to store and requires just 1 shot and can be given to people 18 and up. I feel comfortable that the safety of these vaccines is being monitored. And folks, never forget what we're dealing with. We may be tired of the coronavirus, but it's not tired of us. We still don't know who's going to get sick, who's going to die. The virus is thriving, but we do not need to let it get the upper hand. This is about preventing deaths and saving lives through vaccination. That's my message today. Stay safe. Continue your protection. And as always, my views are my own. And have a blessed day.